MZ is a 33-year-old Hispanic English-speaking male with reports of a sore, scratchy throat for 2 weeks. HBI. Patient reports onset of symptoms began after he attended an outside birthday party for a family member times 2 weeks ago. Reports symptoms began with a, quote, scratchy, irritated throat with worse pain in the morning and decreases in severity as the day passes. Patient states, quote, throughout the day, when my voice gets louder to have a conversation, I feel a sharp pain in my throat and my voice becomes hoarse. Reports nasal congestion with clear, watery drainage that is present all day long with frequent sneezing. He reports, quote, full, clogged ears bilaterally and ear popping when blowing his nose worse on the right. Reports frequent cough, worse at night, dry, irritated, with yellowish mucus occasionally produced. Reports that all symptoms do not have a clear pattern and are better some days and worse on other days. Patient reports taking Mucinex D, throat numbing spray, cough drops, Alka-Seltzer, and Vicks rub at home with no relief. Does not recall having any sick contacts. Patient reports that these same symptoms occur around this time every year, but he feels that they have never been as severe. Denies fever or chills. Past medical history. Hypertension, he takes amlodipine mesylate PO 10 milligrams daily and lisinopril 40 milligram PO daily. Depression, he takes buspirone 5 milligram PO twice a day and escitalopram oxalate 20 milligrams once daily, and he follows up with a psychiatrist and a counselor biweekly. Morbid obesity, patient is currently taking Ozempic zero point 0.5 milligrams sub-Q weekly and is also implementing lifestyle modifications. And obstructive sleep apnea, he follows up with ENT for that. Patient has no known allergies. Patient surgical history includes balloon sinuplasty in 2020, hemorrhoidectomy in 2023, laryngotomy with ear tube placement as a child, and tonsillectomy as a child. Patient reports that he has not received any vaccinations since high school. Family history. His father is alive at 67 years old with a history of hypertension. His mother is alive at 62 years old with a history of diabetes mellitus. Sister is alive, 30, no medical problems. Paternal grandfather is deceased of an acute MI, 75 years old. Paternal grandmother deceased, CVA, 70 years old. Maternal grandfather deceased, congestive heart failure, 80. Maternal grandmother deceased, severe sepsis, 80. Social history. Patient's a non-smoker with no history of substance abuse. Reports that he drinks 2 to 4 times out of the month and drinks 1 to 2 drinks only. Reports that he's made many changes to his diet in the last 2 months, including avoiding fried foods and soda and adding exercise 4 to 4 times per week. From previous records, the patient has lost 30 pounds since implementing changes. Patient works as a mechanic at a local car dealership and has been employed there for the last 10 years. States that he enjoys his job and the people that he works with. Reports less free time now that he has started working out, but still makes time at night to read books or watch shows to relax. Patient lives in a 2-bedroom, 1,200 square foot home. Reports that he lives in an older, well-established part of the city that's seen an increase in crime in the last 4 years. However, he has lived in the same home for 5 years and has no intention of moving, nor does he feel unsafe in his home. Reports that his home is older and he has been updating it. Reports working smoke and carbon monoxide detectors in almost every room. Reports girlfriend of 2 years has been living with him for the last year. They have no children. Reports that they have a good relationship. Reports girlfriend works at a bank and they see each other every evening after work. He reports that his girlfriend is very supportive in his weight loss journey and even helps him cook and meal prep his food for the week. And reports that he has a group of longtime friends that he hangs out with every Sunday watching football or playing cards. Reports that he believes in God and used to attend a local Catholic church but does not attend regularly anymore. Reports that his parents still live in the area and he visits them regularly. Patient reports that he began taking medications for depression about 3 months ago and has been seeing a counselor biweekly. Reports that he became depressed after a family member made fun of his weight. Reports that the medications and therapy have stabilized his depression and keeps him motivated to reach his goals. Review of systems. Constitutional, denies fever, fatigue. Eyes, admits watery, itchy eyes, denies change in vision, floaters, or light sensitivity. Ears, admits congestion, denies ear pain, hearing loss, vertigo, or discharge. Nose, admits clear, watery, constant nasal drainage. Congestion, frequent sneezing, denies decreased sense of smell and nosebleeds. Mouth, denies dental pain, loose teeth, bleeding gums, or mouth ulcers. Throat, admits sore, scratchy throat, pain when swallowing, that's worse in the morning. Neck, denies neck pain, swelling, or muscle stiffness. Respiratory, admits dry cough only at night, non-productive, occasional yellow mucus production with forceful cough. Denies shortness of breath, wheezing, difficulty breathing, chest pain on deep inhalation. Cardiovascular, denies chest pain, tightness, numbness, palpitations, tachycardia, color changes in fingers or toes. edema or leg pain when walking. Integumentary denies itching or a rash. Lymphatic denies swollen glands. Objective data. Vital signs: blood pressure is 124/76. Temperature is 98.2 by mouth. Heart rate 98. Respiratory rate is 16. O2 sat is 98% on room air. Height is 5'8". Weight is 275 pounds with a BMI of 41.8. General: he's well groomed, dressed appropriately in his work uniform, maintains eye contact, no signs of distress. Hair is evenly distributed, no evidence of rashes. Normal cephalic, non-tender frontal and maxillary sinuses. Mild erythema noted to the bilateral conjunctiva, watery drainage, mild redness to sclera, perla. External ear equal in size, no redness, drainage, swelling bilaterally. Otoscope findings include moderate amounts of fluid in both ears, worse in the right ear. Tympanic membrane still intact, bilateral, positive light reflex, pearly gray, no swelling to the inner ear canal, no discharge. Swollen, pale nasal turbinates and nasal passages bilaterally, moderate amounts of clear rhinorrhea. Mouth, buccal mucosa pink and moist, mild cracking and dryness to lips, no evidence of dental caries. Mild erythema to the throat, cobblestoning to the back of the throat, clear postnasal drip, no swelling noted to the pharynx, tonsils not present, no lesions or plaques noted, frequent clearing of throat noted, soft palate rises and falls symmetrically, uvula midline. Neck, full range of motion, no pain or stiffness noted, no JVD present, trachea midline, carotid pulse 2+ bilaterally. Respiratory, lungs clear in all fields, chest symmetrical, full expansion of chest, no accessory muscle use, respirations deep and unlabored. Cardiovascular, no cyanosis, no digital clubbing, capillary refill less than 3 seconds bilaterally in all extremities, no murmurs, no heaves or lifts noted, S1, S2 audible, no edema in all extremities, peripheral pulse is strong in all extremities, 2+. Integumentary, no rashes, bruises, lesions, hives noted, warm and pink. Neurological, await alert oriented ×3, no tremors, answers appropriately. Psychiatric, answers questions without hesitation, maintains eye contact, no evidence of visual or auditory hallucinations, cheerful, smiling, laughing frequently. Laboratory data is a viral respiratory panel swab result, negative. Me and my preceptor determined that there was no need for blood work based on his symptoms. My differentials include J30.9 acute allergic rhinitis, JO6.9 acute upper respiratory infection, unspecified, and JO2.9 acute pharyngitis, unspecified. Acute allergic rhinitis positives include red conjunctiva, watery eyes, pale, boggy, swollen turbinates and nasal passages, and clear drainage, frequent sneezing, cobblestone appearance to the back of the throat, clear postnasal drip, sore throat upon waking. Reports that the symptoms began when the weather began to warm up and the flowers began to bloom. Fluid present in ears. At his job, they've been working with the shop doors open, and it changes in severity from day to day based on the weather and is commonly associated with sleep apnea. Negatives is that the patient does not recall if he's ever had a problem with allergies or has ever taken anything for allergies. Acute upper respiratory infection. Positives include a dry, weak cough with occasional yellow mucus production, nasal congestion, sore throat upon waking, dry, irritated throat, fluid present in ears. Negatives include the viral respiratory swab was negative, non-palpable lymph nodes, denies fever, chills, non-tender sinuses, no sick contacts, and clear nasal discharge. Acute pharyngitis. Positives include mild tenderness to the throat and mild redness. Negatives include a non-swollen pharynx, no lesions or plaques, non-tender neck, no fever, chills, no known sick contacts, and the patient reports that this occurs seasonally, and this was not a sporadic occurrence. I ended up diagnosing him with acute allergic rhinitis, and we're going to treat him with generic Claritin or loratadine, 10 milligrams POQ daily AM, and generic Flonase or fluticasone propionate, 16-gram container, 120 sprays. 1 spray per nostril twice a daily times 1 week, and then 2 sprays each nostril once daily. And then also we're going to give him a Kenalog triamcinolone acetonide 40 milligram IM shot. We wanted to use short-term steroids in order to not interfere with his weight loss progress, and we also located that in the Hollier clinical guideline book. All of those are secondary interventions and direct clinical practice and evidence-based research. We instructed the patient to minimize continuous exposure to commonly known allergens, such as dust and plants, etc. Secondary intervention, direct clinical practice, evidence-based research. Call and check on the patient times 2 weeks. We'll make the decision to advance/change meds based on symptoms. secondary intervention, collaboration, evidence-based practice, and reinforce the need or importance of weight loss regimen. Patient has been doing well. Keep encouraging him to prevent obesity-related problems such as cardiovascular risk and diabetes. Secondary intervention, evidence-based practice, all found in Holly A clinical practice guidelines in primary care. Follow up, we'll call in 2 weeks to evaluate the severity and character of symptoms. He has a 6-month wellness checkup that's already scheduled for May with fasting blood work. Patient understands to go to the nearest ER if he develops an increase in shortness of breath and wheezing. Level of billing is 99215, office or other outpatient visit for an established patient. Thank you.